Okay, so good afternoon, everyone. We are back once again with another Hira of our chapter. Good afternoon. This is Monica Singh from BNI Hira, and the next Hira who is joining us today is Dr. Milind Desai. Good afternoon, sir.
Good afternoon, Monica ji.
Okay, so let me quickly introduce Dr. Milind Desai to you. Dr. Milind Desai has a clinic called Smiles for You Speciality Dental Implant Center. He is into this business since past 24 years. He's with BNI since last 9 months. The business that he's received from BNI is about 1.25 lakhs. He is an expert in beautifying smiles of people not only in Kandivali but also from the US, Canada, UAE, Zimbabwe, etc. So he's got an international clientele as well. The USP of his business is aesthetic dentistry and implant dentistry with full mouth rehabilitation treatment and also a very, very unique dental annual maintenance plan. Thank you so much for joining us, Milind, sir.
Thank you, thank you.
So he is the reason behind the beautiful smile that you see. He is the reason behind healthy teeth. So we're going to talk to him more in detail during this session. I hope you guys are all ready with a pen and paper because he's going to give you very, very good tips to keep your teeth and your mouth healthy. So let's start, Milind, sir.
Yeah, definitely.
So first of all, sir, I'm very interested in knowing what is it that made you decide that you want to be a dentist? Can you take us through your life journey?
Yeah, from beginning I was little bright student, so parents and family का expectations बढ़ जाते हैं.
Correct. दो ही था ना वो टाइम पे तो दो ही चीजें थी ना सर या इंजीनियर बन जाओ या डॉक्टर बन जाओ.
Yeah. So my mother and grandfather wanted me to become a doctor.
Wow.
And then I decided, since dentistry is little more artistic and there are no visits after the clinic, so I chose dentistry.
Okay. थोड़ा convenience के लिए आपने dentistry choose कर लिया.
Yeah, you should have family time also, na?
Absolutely. Otherwise, doctors तो आज के time पे हमें पता है that how busy they are and you don't get time for yourself.
Yeah, so I graduated from one of the premier institute of India, Nair Hospital Dental College in 1997.
Wow.
Worked with few stalwarts, and since 2001, I am operating in Kandivali. So
Okay.
it is almost 20 years I completed in this July in Kandivali. So it's our 20th anniversary going on.
Wow. So a long time in this profession, sir. So of course, nobody better than you to answer a couple of questions that we have in mind when it comes to dentistry. So sir, first, my very, very basic question is that what can kids do to avoid cavities?
Yeah, nowadays it is very, very scary scenario when kids come up with 10 cavities, 12 cavities at the age of 5, 6, 8.
Yeah.
It becomes really difficult and challenging for us to treat them. Basically, kids are having more cavities due to two reasons. One is exposure of food, where they are having more of fermented and sticky foods, especially if you take colas and popcorns and wafers and kurkures and cheese balls, everything is sticking and they have it in between meals. So it remains in contact with your teeth for 3 hours, 4 hours, 5 hours. So you need to tell them that along with, if they are eating those things, they need to clean their mouth afterwards eating salad or doing. If they are eating chocolate,
I think you have logged in from the phone also because my voice is echoing. Is that so?
No.
Okay, all right. I'm so sorry. I could hear my voice. Okay. No problem. So Milind sir, I also believe that you had mentioned that you would want to share your presentation, which will give us a little more in-depth knowledge about what you do.
Yeah,
so
definitely.
Can we do that now?
Yeah.
Okay, yeah.
Can you see the presentation?
Yes, sir, we can.
Yeah, so here it is. I'm Dr. Milind Desai, dental implant surgeon, member Indian Society of Oral Implantologists, member Indian Dental Association, Jain Doctors Federation, Kandivali Medical Association, and a proud member of BNI Hira.
Yes.
This is my setup, Smiles for You Specialty Dental Implant Center, located at Rashmi Tara, opposite Dutt Mandir, Dahanukarwadi, Kandivali West. So let me tell you about oral hygiene and the dental
Right.
care.
Yes.
It is Oral hygiene is the practice of keeping our mouth and teeth clean and healthy. If you are having good oral hygiene, you can keep dental caries, periodontal disease, bad breath, and all other dental problems away. So, how can you achieve that? And why you need to achieve that? Are you aware if you are having Alzheimer's, your respiratory problems, heart problems, arthritis, and diabetes, gum disease can be the villain in that. So if you are having all those diseases, just get and check your oral cavity also, because your dental health is linked to systemic health.
Oh.
So next time if you see person is having uncontrolled diabetes, ask him to get dental examination done. That can be controlled with proper gum disease care.
Okay.
Now brushing. Now everything has become fast in our life, but I
Yes.
tell my patient, don't rush when you brush, otherwise you'll lose. So for brushing, always use a soft or a medium bristle, narrow head and a flexible toothbrush, anti-cavity fluoride toothpaste, and brush minimum at least 2 times a day and 2 minutes. That is the basic you require.
So, sir, these days there are these different toothpastes available for kids. So,
Yes, yes.
so should we actually buy those or should we use the ones that we use?
Depends if you are using the fluoridated ones, children require little less fluoride. So you
Okay.
need to, if the child is below 6 years, you need to have a special toothpaste for them,
Okay. Okay. But
because
sir,
the
what happens
fluoride,
if a child
if
is above
excess is
6?
also bad.
What happens if the child is
Then
above 6
he can
and
use
still
this.
using, but still using the kids'
No,
toothpaste?
no.
It won't work, is it?
Yeah, it won't work that nicely.
Okay. Okay. Understood. Yes, sir.
So
Please continue.
yeah, the basic question is, people are just starts brushing, but never learn it.
Right.
How many of us learn brushing from a professional? They come for treatment. Thousands of patients do come, but hardly one or two ask me, like, doctor, show me the proper brushing technique so that next time I don't have less cavities.
Oh.
So next time if you plan to visit your dentist,
Mm-hmm.
please learn the brushing,
Right.
because otherwise your breath will speak louder than your words if you are not brushing properly.
Right.
You can start from one corner, reach the other corner. So you are counting all your teeth. Same way you have to do it from inner side also and the chewing surface also. And
Right.
another thing you need to take care is start from gum towards teeth. Never go from teeth to gum. You will keep on damaging your gums.
Okay. And how effective are these electronic toothbrushes, the motorized ones, or should we stick to
Yeah,
the
they are.
traditional?
Yeah, they are good, because if your motions are not perfect, at least they have a certain motion, so you can do it. So they are good.
Okay. Fair enough.
Especially we are recommending those to parents who tell us that our children are lazy in brushing and everything.
Right.
So
Right.
that gives little new thing to them, so they are more inclined to brushing with that gadget. Because nowadays children they are just like
Love
gadgets.
gadgets. Yes.
Yeah.
Okay. Yeah.
So also about changing a toothbrush, I need to clarify the doubts of people, because people are confused when to change. So So it is generally, ideally, it is 3 to 4 months time you should change your toothbrush. And within 3 to 4 months, your bristles are not getting frayed. You are applying too less a pressure. So you need to increase. And if it is getting frayed before that, you are applying too much pressure. So you should not do that. Also, during any viral disease, because microorganisms tends to remain on your brush. So after any illness, you should change, especially COVID, which is for longer duration. I recommend all to change after the COVID if they are undergoing that. And during the disease also, they can disinfect the brush by dipping it in a mouthwash.
Okay.
See, how many times do you brush and do you check have you brushed effectively? These are the two questions which I ask my patients to decide, do they require annual maintenance plan or not. As you told okay, we have that unique maintenance plan. We judge the people with that, because if you are locking your door, you pull the lock and check, but do you check you have brushed effectively or not?
It's a very important thing.
Yeah, very important thing. And we teach this in during our annual maintenance plan and during the child detailed consultation visits.
Okay.
Now brushing, there are so many patients who tell us that we are brushing regularly, doc, still we are having cavities. What is the reason?
I was about to ask that, what can you do to prevent cavities if you're regularly brushing, keeping your teeth clean, keeping your mouth clean, but still you have cavities? So what is the reason and what can be done to prevent that?
Yeah. See, if India is playing, can you depend only on Kohli to win all the matches?
No, it's a teamwork.
Yeah, so same way, our mouth has almost 600 species of microorganisms hiding everywhere, and brushing reaches only on the visible surfaces. So that cannot keep your mouth 100% clean. You need to add in your team flossing, mouthwash, interdental brushing, water flosser, tongue cleaner, and gum massaging to make a complete team. Because as the survey says, brushing only removes 43% of the plaque. 57% is remaining for the other things.
Oh my God.
So if you are doing only brushing, you are bound to have cavity. And if you are not ready to add all this in your team, that's why we have come up with this annual maintenance plan. As we conclude, oral hygiene is a joint effort between you and your dentist. So regular dental visits are required. But ये भाग दौड़ भरी जिंदगी में dental health जो इंडिया में the most neglected है, तो उसके लिए dental visit के लिए याद रखना becomes very difficult.
तो जब तक वो दांत में unbearable pain नहीं हो जाता, I doubt if anybody willingly goes for these kind of checkups and makes sure, जैसे हम अपना annual body checkup करवाते हैं to see if all the vitamins are in place, the hemoglobin is in place.
Yeah.
Mouth, actually, as you said, dental hygiene is the most ignored part of hygiene.
Yeah. See, as you told, annual maintenance. Let me tell you, you are taking annual maintenance for your AC so that it works efficiently.
Yes.
You are taking it for your car.
Yes.
But are you taking it for your teeth?
Yes.
So that's why that idea we have come up since 2007, and we are doing it, and patients are happily enjoying, so that they are not undergoing root canal treatments. If we are calling them every 4 monthly for regular checkup, so that dental disease can be detected early
and prevented. Yeah.
So as I was telling you, regular dental visits is the key, because our tooth is the only part in the body which cannot heal itself. Skin पे लग गया, heal हो जाएगा अपने आप. But teeth में cavity हुआ, it is going to increase only.
Yeah.
It is never going to heal itself.
Right.
That's why you need maintenance plan.
So,
Yeah,
okay, so this is your annual maintenance plan that you were talking about.
yes, yes. See, in this plan, we are calling the patients 3 times in a year so that disease can be checked early.
Right.
Other than this uniqueness, our Smiles for You, why you should choose Smiles for You, let me tell you.
Right.
We are the experienced team of doctors and specialists beautifying smiles since 1997 and technologically advanced center with detailed preventive consultations for children and adults. All latest gadgets, laser dentistry, digital scanning, single sitting root canals, the invisible braces or the clear aligners. Now days are gone of that metal braces.
Yes, yes.
So we have those also. We do smile makeover. Then we have advanced implant surgeries, metal-free
Sir,
crowns.
so now that you're talking about implant surgeries, I had one question.
Yeah.
Why are these implant surgeries so expensive, sir? I mean, there are times when you go for any kind of implants and the cost is really, really high. What is
Yeah,
the
yeah.
reason behind that?
Yeah, definitely. I'll come to that also
Sure.
because as today I had prepared the presentation for clearing the doubt of masses.
Right.
So I'll come to that also.
Yes.
Uh,
Costing is the biggest bump.
what is more costly? It is the dental treatment or the neglect?
Right.
इसके लिए
Okay.
सबसे सिंपल आंसर है, अगर आग लगेगी तभी आप कुआं खोदोगे तो क्या होगा? डेफिनेटली नुकसान ज्यादा होगा.
नुकसान ज्यादा होगा, आग बढ़ जाएगी जी.
वैसे ही अगर पेशेंट एज यू वर सेइंग के पेन हुआ तभी डेंटिस्ट के पास विजिट करेगा तो डेफिनेटली ट्रीटमेंट एंड कॉस्टिंग विल बी मोर. दैट्स व्हाई डेंटिस्ट्री becomes expensive because of the neglect, not due to treatment. If you are going regularly, what you'll require? Maximum cleaning or a filling that doesn't cost you more. So let me come back to the Smiles for You. We are continuously learning and upgrading to give you the best dental plans. I've successfully placed more than 1100 dental implants, completed more than 4500 root canals to save teeth. We are giving the expert guidance and the treatment plan, and we are trusted by not only people from Kandivali, Mumbai, India, but global citizens are trusting us because as you are saying the treatment cost world over is more than 10 times than India.
Oh.
That's why the medical tourism is occurring and people are preferring India as the best destination for dental treatment.
Right.
Another one more reason, because we have been nominated for top 100 doctors in dentistry. Let me show you a few of our cases.
Right.
A success story of this model. She chipped one of her front teeth and we accommodate her in the setting in the morning, and by evening she was ready to shoot.
Wow.
This is one more story of a UAE based patient. He had come to us for dental implants and we did her smile makeover with dental implants. This is again a patient from Zimbabwe. She had come to us for only 10 days and we did her all the fillings and beautified her smile with the veneers. This is again one more bank manager from India. She was having smile, but all her colleagues were telling your teeth are appearing broken. So we beautified her smile with veneers. Again, the teeth whitening in 1 hour for brides and grooms, which we are doing. There are few NRIs who come here to attend the wedding. They get this treatment done because for them it is less than $100.
Yeah.
These are the clear aligners. Can you make out this person is wearing a braces?
No, actually, if you wouldn't have said, I wouldn't have noticed at all.
Yeah, that is this thing about the clear aligners. No one makes out you are wearing a braces.
But then, sir, these aligners don't they pose a problem in eating and stuff, or do you have to remove them when you eat?
You have to remove it. That is the convenience. Okay, whenever you have some meetings or anything where you don't want to show, you can remove it. While eating, you can remove it.
Okay, yeah.
These are few of our patients from USA, UAE. Another things which you can do at home is by just modify your eating pattern. You can eat right to smile bright. I always recommend Indian tradition in food, not the Western tradition.
Right.
Because you take all the Indian sweets, rasgulla, shira, halwa, everything is eaten with food. So teeth gets clean automatically. And when you go to Western culture, desserts and everything which you eat after food, it remains in contact with food and you are gone with cavity. So these are the few foods which are recommended for teeth cleaning. They are called teeth cleaning food. Cheese, yogurts, leafy vegetables, apples, carrots, cereal, almonds and raisin. You can give your child along with chocolates all this food so that they'll not have cavities. So you can show your child, decision is there, what they want.
Right.
So you can also do preventive dentistry, like certain preventive treatments which we can do is fluoride treatments and sealants. Fluoride can be applied in gel form or the varnish form. And sealants are basically, we applied it in the younger generation, toddlers and also in adults, because these are the grooves from where the cavity starts. They are sealed with sealant.
Okay. Oh my God.
See, this is the reason why healthy smile is important.
It's very, very important.
If you are not with teeth, smile becomes
Scary.
what people notice when they meet someone. According to survey, it is not the eyes or the smell or the clothes, it is the smile. So you need to have good smile. And what can the missing teeth can give you? It can alter your smile, speech, appearance and your confidence.
Right.
So you can replace your missing teeth on time, otherwise you can have faulty chewing habits, teeth movements, bone loss,
Bite complications.
jaw pain and headache, and these headaches cannot be cured by any doctor. It is the dentist only can cure that. And it can give you premature aged low. How can you replace your missing teeth? As I was saying, it is the implants, bridges and denture, and implant being the
Now that I'm so sorry, you spoke about dentures. So there is a question that has come up from a viewer which says, what are the disadvantages of dentures? Why to select fixed teeth option?
See, basically dentures are something you are wearing on top. And our oral cavity, as you are aware, एक बाल आ गया तो भी पता चलता है. It is so sensitive. The hair, the thickness is less than a millimeter. And dentures are, if you are wearing 2 millimeter, 3 millimeter denture in your mouth, you need to have your temperament. If a person is psychologically patient, then he can accept the denture. Otherwise, आधे जन का आप सुनोगे denture सिर्फ बाहर रहता है.
Yeah.
अगर जिद्दी है person, तो it is difficult to cope up with the denture. That's why the fixed teeth comes in the picture. And it is moving thing. You have so many restrictions. If you are drinking water from top, your denture starts rocking and swimming. So that all difficulties are there. If you are sneezing, it can fall out.
So I would say that dentures are probably a very old way of fixing, the missing teeth problem, or So now that the technology has advanced, a fixed teeth option is anytime.
Yeah, that's why I whenever a consultation with older people are there, I tell them to come with their son or daughter, because those generations were उनसे पैसा छूटता नहीं था. They opt denture and then फिर denture बाहर पड़ा रहता है. So I explain them in detail. I analyze how the person is if it is nature is accepting, they can go for denture. No problem.
Right, understood.
Now, as you were saying about the expense,
Yeah.
see, the root canal treatment cost in India is around 5 to 7,000.
Okay.
In USA, it is around 800 to
Oh my God.
$1,000. In Europe, it is 300 euros. And if you are talking about implants, in India, the rough cost is 25 to 40,000. And USA around $4,000. Europe,
Yeah.
1,300 to 1,400 euros. And forget about the cost everywhere. Right now, what you call a basic necessity, your smartphone, how much you spend for your smartphone? 30,000,
Yeah,
40,000,
40, 50. Yeah.
1 lakh for iPhone.
Yes.
And how often do you change it? Every year?
Every year or once in 2 years.
Yeah, so the cost is almost 40,000 a year. And if you are spending same 40,000 for implants, the minimum life is at least 10 years. And if you are taking care, it is 20 years. So if you are considering 10 years, so your expense is only 4,000 a year. So now you tell me how it is costly. If you are going for holidays, how much you
Yeah.
spend for 3 to 4 days?
Correct. Correct. This
And
is
this
the
you are
basic.
going to use for 10 years. So your
Yeah.
costing is just 10 rupee a day.
Correct.
That's why we have come up with annual maintenance plan. And as I told you, if we are having 20th anniversary, what we cover, let me tell you what we are covering in our annual maintenance plan.
Yeah.
2 consultations plus an emergency consultation,
Okay.
complete knowledge and guidance about brushing technique, diet changes and teeth cleaning foods,
Okay.
1 X-ray, and if they don't require a X-ray, a family member consultation, teeth
Okay.
cleaning, fluoride treatment to prevent or a filling, whichever patient requires.
Okay.
And because of this anniversary offer, we have added this till Monday. The costing which I offer generally worth 3,100 plan for 1,600. Right now we are offering at 1,200 rupees.
Wow.
And plus, that's not all. Additional 10% discount in the treatment up to rupees 5,000 if you are getting the treatment done till October end. And we
Nice.
also have
Very
about
nice.
family of 2 plan and the corporate plan.
Right.
So if you are planning to purchase one, you can do Phone Pay and GPay on this number 98922 35131. Send us a clip on WhatsApp and our team will get back to you. Also, you can see our detailed work on our website smilesforyoudentalclinic.in or our FB or Google My Business page. Thank you. I hope I have cleared most of your doubts.
Yes, yes, sir. In fact, not most. You have cleared almost all the doubts. You can now close the presentation, sir. But we'll take up a couple of question answers from the viewers. So there's one question which says, for invisible braces, is there any age criteria or is it inconvenient?
Not at all. There are
There is
no
no
age
age
criteria. The patient can undergo at any age. And as I told you, it is quite convenient.
Right. So, sir, how much time is required to undergo a braces treatment and alignment treatment?
Depends on person to person. It might be from 8 to 9 months to almost a year.
One and a half year. All right.
Yeah,
All
yeah.
right. All right. So, and also, sir, do you give do you give online consultations?
Yeah, because of the COVID, we have started.
Right. So, how does somebody get in touch with you if they want to have an online consultation? Do they need to connect with you on the WhatsApp?
Yeah, they need to connect us on WhatsApp so we can fix a convenient time and then they can have it.
Okay. All right. And sir, what are your work timings or your clinic timings?
They are morning 10 to 1:30 and evening 5 to 8:30.
Okay, so anybody who is viewing our session today, please get in touch with Milind sir for any teeth related problem, because you must have seen the presentation and understood that he understands teeth and dental hygiene and oral hygiene so much in detail that you are in safe hands if you go to him. So the viewers, if you have any more questions, please feel free to put in the chat box. So, sir, there are people who are saying that you've explained it really well in very, very simple terms. The examples that you've given are really good. And I'm sure you will be a little more busy after this session because your annual maintenance plan is really, really very, very lucrative. 1,200 rupees, guys, for 1 year, which is 100 rupees a month, in which you're getting an expert guidance, you get an emergency checkup, you also can get an X-ray done, you have a diet consultation, so many benefits and with actually a nominal cost. So please do not miss this opportunity. Anybody who wishes to get in touch with Milind sir, please note down his number on his screen, sir. If you can just tell people how to get in touch with you.
Yeah, they can get in touch through our website. My telephone number 98922-35131. Another clinic number 730-36-35131.
Okay, and also due to COVID times, they are taking appointments. They are taking patients with prior appointments. So kindly book your appointment at the earliest to avoid any kind of disappointment at the last minute. So once again, thank you so much, Milind sir, for spending your Saturday afternoon with us and telling us so much in detail about oral hygiene and the basics that we should be knowing. Since childhood, there are so many eye-opening facts that we've learned today.
Yeah, pleasure is all mine.
Thank you so much, Milind sir, and thank you so much, viewers, once again for connecting with us and spending your Saturday afternoon with us. You can go and have your chai coffee now, but remember that you need to brush 3 times a day, at least for 2 minutes. So don't forget that. And we will meet you next Saturday with 2 more heroes of our chapter who will come and explain their business in detail to you. Do put in the comment box if you've enjoyed this session. Do share it with your friends and families. And try to avail services from Dr. Milind Desai, our in-house dentist. Thank you so much, Milind sir, and have a great day.
Thank you, Monica ji.